Hi, and welcome to On Air with Vyaire, podcasts from the front lines, an educational podcast series featuring discussions with frontline medical experts about their experiences ranging from airway management or the dynamics of recognizing, preparing, and managing patients with COVID-19. At Vyaire, we are truly proud to partner with you on the front lines of the COVID-19 global health crisis, and thank you for the work you are doing to help improve outcomes for patients with COVID-19 around the world. The host of Podcasts from the Front Lines is Vyaire Vice President, Medical Director Michael Pedro, MD. This episode is focused on flattening the curve and features our guest medical expert, Dr. Stephen Minear, Director of Research for the Center for Hospital-Based Specialties, the Cleveland Clinic, Florida Region, Weston. This podcast is for educational purposes only. The scientific exchange content in the podcasts from the front lines may address the off-label use of Vyaire devices and supplies that are the sole responsibility of the device or supply's owner, and is undertaken with the understanding that the owner assumes all liability for such use.
On today's episode, we'll provide an update on the recent remdesivir evidence, as well as discuss the effects social distancing has had on flattening the curve and the controversy of immunity certification with COVID-19. Joining us again today is Dr. Steve Minear, board certified in anesthesiology and critical care medicine, and currently associate staff at Cleveland Clinic, Florida, Region Weston. We also have with us today from Vyaire Medical, Kyle Turner, who's one of our clinical specialists. Welcome, Kyle, and welcome, Dr. Minear.
Hi, thanks for having me.
Kyle, what's your take on how we've done as a society, flattening the curve, and how do you think this would impact you as a clinician?
I think originally it was kind of what Dr. Minear was talking about, was being able to make it so we had our resources, and epidemiologists didn't say, hey, yeah, now we're not going to get a bunch of cases, right? People are still going to get COVID. It's just been interesting as things have gone on, how society has responded. I feel like now there's some of that fear that Dr. Minear talked about to maybe go out and get treatment or things of that nature because they're afraid they're gonna pick up COVID. But I believe that now that the curve has been flattened, getting back out into life as things start to open up and governments start to open things up, we will see that second wave. Dr. Minear, I wanted to ask you a question. If you look back at your time, your first COVID patient, and all of the things that you've learned from that COVID patient through the up until now, what do you think perhaps that you didn't know then that you know now is going to help you going forward as you prepare for the second wave of COVID patients?
That's a great question, Kyle. And I think that I think it's a very important one. And that's something that as a group, as a human, frankly, when you receive a threat that's a pandemic, meaning it's threatening all around the world, the way we respond to that is very important. My opinion of COVID treatments has actually not changed. And I told you in my very first podcast here that the treatment for COVID-19 is oxygen and time. And whatever we need to do to as for adjunctive therapies to facilitate that the patient is able to receive both those things for a long enough period of time that they are able to survive this disease and get better as quickly as possible. My opinion has not changed by the amount of data that's come across my desk. I think it's very interesting that we as a nation have come almost full circle, where we are, of course, very proud of our research process as a nation and as a world. And we watched that take a spin when COVID came up, where we were ready to believe anything, as it were. We were ready to take very low patient population data sets and very low margins for statistical significance and accept those as the new standard of care. And now we've come again full circle to really carefully and thoughtfully evaluating these data sets to come into a more thoughtful, patterned, reasoned approach and randomized trials that have a priori hypotheses and really can be truly make conclusions off of, as opposed to just taking this data series and that case series and this patient case report that I saw and these guys use this drug and the patient got better. Should we use it on all of our patients? It's very interesting to see that come all the way back around and having everybody again back on the thoughtful approach of let's all carefully design our trials to objectively interpret and come up with real conclusions. So we definitely know more about how to treat COVID-19. I think that even just these data sets that we have, people and statisticians and people with far more brain power than myself will be chewing on these data sets for years, coming to find out what real conclusions can be drawn. And it will be interesting to see those data sets be interpreted and reinterpreted as more data comes in. And probably what will happen is there will be several landmark trials, I certainly hope and would expect to see those coming up in the next year or two, and then having the data sets that exist now be adjunctive, supportive viewpoints onto those landmark trials. I personally don't think we've seen the landmark trial on COVID-19. There likely will be several, but I don't think it's come across my desk yet.
Thank you for joining us today. To suggest a topic for future podcasts from the front lines or to stay informed, please visit us at Vyaire.com.